Going into college, I didn't think I was going to struggle with something other than schoolwork. And now with this new lingering feeling that might affect my college experience, this is the one I applied for. I have experience in this firsthand with my friends and myself who struggle with mental health problems in college. I have become passionate about this because I've seen the effects of student health and the effects of pressure to succeed and financial burdens. You will want to listen to this today because we are all here to get degrees, and we need to be mentally healthy to be able to pursue it. Now, today I will be discussing the current status, the pressure to succeed, and the financial burdens to get help. Now, to start understanding the problem at the university, it is important to look at the current status. According to the National Alliance of Mental Health Illness, and 1 in 4 young adults between the ages of 18 and 24 have a diagnosable mental illness, and 1 in 5 adults experience serious mental illness each year. And roughly around 75% of all lifetime mental illnesses begin by the age of 24. So according to a survey I did at the university with roughly around 100 participants between the freshman year and senior year about mental health, the main question was, have you experienced any kind of mental health problems in college, such as stress, anxiety, depression, or anything else? And 90% said yes, and 10% said no. As you can see, there is a big majority of mental problems in the nation and on our campus. Now, let's see one of the effects of the presence of mental health problems. According to Greg Hendricks, a professor of psychology at James Madison University, there is a massive grade inflation, which means that the grades from high school to college are not the same. You might get an A in high school, but you might get a B in college. And also, this has an effect over protective parenting on college students, which most of the time they have high expectations, but most fail to meet those expectations. So that leads to a stressful situation for the college student. Now, according to the Journal of American College of Health, the assertion of parenting are associated with the outcomes in a college setting. So that means whatever parenting style that the parent has on the student can affect the way the student is in college. Now, going back to the survey again, one of the questions also was, if you have experienced mental health struggles, what do you feel is the leading cause of it? And 75% say the leading cause was from pressure to succeed. Not only do students suffer from many mental health problems, the effects of pressure to succeed can cause more problems on top of that. But how does this burden have on mental health illness? So according to the University of Arkansas Pat Walker Health Center, there is no charge for services or any services they have and initial counseling assessments, but individual counseling is $20 per session. And then the initial psychiatric consultation is $85, and every follow-up after that is $40. Now, there are late fees, and for the psychiatric no-show late cancellation for a new patient is $85 on top of the other $85. And then for an established patient, it is $40. Now, for counseling no-show late cancellation is $20 for new and an established patient. Now, for the billing side, all CAP services are billed to the student's UA Connect account, and CAPS does not accept or bill any insurance at all. As you can see from both counseling and psychiatric appointments, and with additional fees for no-show or late cancellation, there's a problem. And this points out that the financial burden on a college student is present due to this. So today I brought to light a problem at the university with the current status, the pressure to succeed, the financial burdens it is to get help. With college coming to an end for some of you, and some may have a couple more years, I'm sure you don't want to be struggling with something other than schoolwork. I know I don't. And now you do not have to worry about the presence of mental health problems at the university, because now you know.